Coming up, you've seen our friends from the Antiage Institute on Houston Life many times over the years, right? I mean, we've talked about it all, from Botox to fillers and laser skin treatments. This is a team known to help their patients, me and Derek, look and feel their best, our best.
That is true. We are patients, full disclosure. So after the break, we're going to learn about two other programs they offer: hormone replacement therapy and weight loss with semaglutide. Both are trending topics. We know you have questions. They've got answers. Don't go away. Houston Life will be right back.
Welcome back to Houston Life. If you're a regular viewer of this show, you've seen our friends from the Anti-Age Institute many times. We talk about Botox, we talk about fillers, all the kind of laser skin treatments. The Anti-Age team is really just known for helping their patients look and feel their best.
Everything you're saying right now. Yep, I've done that and the lasers, the Botox, it all. Well, in addition to that, they are also helping patients look and feel their best with hormone replacement therapy and weight loss with drugs like semaglutide. Joining us now from the Anti-Age Institute, Dr. Richard LeConey, along with patients Mary Patronella and Ellen Van Lunden. Welcome to all three of you. It's great to see you.
Thank you. Good to be here.
Okay, and by the way, Mary and Ellen have been patients for more than 20 years. As you can see, they look flawless. They look phenomenal. But Rich, we're going to start with you. A lot of people these days, we're seeing on social media these ads for weight loss drugs. I mean, I feel like I always joke like you can go to the gas station and get semaglutide, but truly, this is a real thing. If you are going down this road, how critical is it that it is done under the supervision of a doctor?
Well, I mean, critical is the word. I mean, how could it be anything else? I mean, you're taking a FDA-approved drug, which is very safe when used properly, and has actually some wonderful effects. I mean, it helps, help you with your blood sugar, it helps you with your weight, and it basically helps you get rid of visceral body fat, which, as we know now, has been tied to heart disease and just about every other bad thing that can happen to you. So if this helps you deal with that in a productive way, it's a great thing. I'd say it's the best really advance in weight control medicine and diabetes to come along in 20, 30 years.
Wow.
It's pretty incredible.
Yeah.
And, Mary, Ellen, you guys can't express enough. You guys look amazing, but you feel good too, right? With the hormone therapy. Mary, why don't you talk a little bit about your experience with Anti-Age?
Well, I'm 65 years old.
What?
65.
The best skin.
Okay.
The best skin.
I'm sorry to interrupt you. Continue.
Thank you. 21 years ago, I was experiencing weight loss. Weight gain. Hot flashes, debilitating hot flashes. I was emotional for no reason at times. I was not sleeping. I saw Dr. LeConey on TV, on a morning TV program, and he was asking the audience, can you sleep? No, I can't. Do you have hot flashes? Yes, I do. All of the things that he talked about, it was me. It was me. And so I immediately made an appointment to get in, made a beeline to see Dr. LeConey. I got to spend an hour and a half with him. We did all the blood work. He just looked at all of the data and just put together a plan for me. And I've been on it for 21 years, and I feel great. I recommend it for everyone. Every year, I get to go and spend an hour and a half with Dr. LeConey, and we go over all kinds of stuff. It's a wonderful program.
And the thing that strikes me about your story, Mary, is that you're absolutely not alone. The story you just told about Dr. LeConey asking people, raise your hand if you've experienced this. There are so many hormone-related issues like low libido, difficulty sleeping, fatigue. We're seeing some of them on the screen. Hair loss. And this is something that as people age, it seems like the weight gain, things just become way more difficult. Ellen, what symptoms were you experiencing, and why did you go to see the Anti-Age Institute?
Well, I started 22 years ago. I was about to have a wedding, so I wanted to look the best in my photos, so I started with the Botox. And through that, became friends with Dr. LeConey and his wife Dana, and with many of the technicians inside who really, really care about what they're doing. They're very professional and they're very specific, and it's very tailored. It's very concierge medicine for you. And over the years, we started with the hormone therapy for me as well, getting ahead of it. And then when I went through that wonderful thing that most women do, if you live long enough, you will go through menopause. I gained 25 pounds.
Wow.
Which for somebody who is very athletic, very active, that was very depressing, very frustrating.
And you're doing the same thing, like eating the same thing, staying active, but suddenly you were gaining weight.
Exactly, and it wouldn't go away. I was doing more cardio, I was doing Whole30, I was doing all kinds of things, and the weight just kept piling on. And it was one, depressing. Both of my parents are type 2 diabetic. I became pre-diabetic. And there's all of that ideology about there in the beginning with semaglutide that, oh, that's only for people diabetic. Don't do it. And so I stayed away for a while. And then I thought, you know, I'm starting to hit some of these markers. I am pre-diabetic. I don't want to die early. I want to get better health. And so I went in. I spoke with Dr. LeConey. We did a very long lab work, went through it in great detail, went through the in-body to see where my body muscle was, where my body fat was, how much was muscle versus fat versus water.
And in-body is a machine that measures all of those things.
Exactly. So we went through in great detail, and they did a dose for me, and we started very low. So all of these symptoms that you hear about, I had none of those, and then a month later came back in. We went through it all again, did the blood work, did the in-body, did the discussions, and from there up to just a smidge, and from there I lost the 25 pounds over 3 months.
That's incredible.
And feel great again.
We're looking at some of the team there. You've got Julie, and you've got who? Oh, I always forget.
Caroline.
Caroline. She's a wonderful receptionist. That in-body is so helpful. I've done it myself. We've both done it. Dr. LeConey, what do you think is, you know, this is so much as we hear the ladies talk, this is so much more common for women. This is, people are suffering really when they hit that menopausal mark. How does that essential hormone therapy help?
Well, you know, if I were to give a plug for anything in all this, it's going to be to the hormones themselves. I mean, if a woman goes through menopause, she loses estrogen, progesterone, and some of her testosterone. So when you lose all these essential hormones, the vitality starts to go out the window right away. I mean, I couldn't say anything more strongly that if a woman goes through menopause and doesn't elect to be at least some type of hormone replacement, she's letting her vitality just kind of fly away. Estrogen affects almost every single tissue in your body. And of course, you see your skin start to kind of dry out, and the oil content drops, and your skin starts to age almost right away. Bones, heart, blood vessels, brain, almost everything is affected in a positive way by the presence of estrogen. And once that's gone, well, things start to go downhill fast. Aging accelerates fast. Estrogen is an anti-aging hormone.
Well, getting in front of it is so important. Dr. Richard LeConey, you are an encyclopedia of knowledge. This guy was an ER doctor for 39 years. Mary, Ellen, you both look great. I'm